Our real mission is that we can't do this alone. We have to be in collaboration with multiple entities. So, with that, I'm going to hand over the mic to Amelia. Amelia Averyt is one of our co-leads on the Immigrant Health Committee, and she's a medicine and pediatrics resident at Baylor.
In my final stretch, I have 4 months left, y'all. Very exciting. But today, I'm not here to brag about how little residency I have left, but to introduce implicit bias and lead this group through an exercise to help illustrate how implicit bias affects everyone. After we examine implicit bias and how it affects each and every one of us in this room, our 2 presenters will help us understand how pervasive it is within the healthcare system, the results of the decisions it influences, and finally, how we may be able to combat it to ensure equitable, quality healthcare to all patients. So first, what is it? The Cure One Institute for the Study of Race and Ethnicity defines it as the attitudes or stereotypes that affect our understanding, actions, and decisions in an unconscious manner. These biases can be both positive or negative. They are activated involuntarily and without awareness or intentional control, and are different from known biases that we choose to act on or choose to conceal from others. Most importantly, they can produce behavior that diverges from someone's declared principles or beliefs. Another way to think about it is through the dual systems theory. This theory divides our brain into 2 working systems. System 1 is the unconscious, automatic, fast, and effortless mode of thought and action. Think of this as like our 2+2 brain. You know it automatically, you don't have to think. Automatic preferences are difficult to explain a lot of the time. They defy the convoluted explanations we usually use to pick apart our otherwise rational decisions that we make. System 2 consists of the reflective, conscious, deliberate, slow, and effortful thought side. This system informs our complex thoughts, actions, and beliefs. Every day, automatic preferences steer us towards unconscious decisions. Oftentimes, our more rational mind is just no match for the automatic. As you can imagine, having 2 brains at work in one person may create conflict. If you've ever had the experience of thinking through an important decision, of knowing what you should choose, maybe that healthy food choice or the reliable gas-efficient car, but opting for the choice you can't explain, that hamburger with a shake or the flashy new Porsche, you've experienced dissociation. Psychologists define this term as the existence in one and the same mind of mutually inconsistent ideas, thoughts, feelings, judgments, or behaviors. Dissociation and dissonance are used to describe both situations in which a person is aware of the conflict and in which the contradictions occur outside of conscious awareness, or, that blissful ignorance we all enjoy on occasion. Once we become aware of these conflicts that violate our natural human striving for mental harmony, we experience cognitive dissonance. It does not come easy at all and can make us very uncomfortable. And also, we don't always know how to react to it or what to do with it. You may be asking yourself, why does this happen? I'm an informed, educated person, but in reality, no one is free from implicit bias. It's just how we're wired. Neuroscience has demonstrated activation in the structures in our brain associated with implicit bias and other unconscious actions and decisions. One of these structures, the amygdala, plays a primary role in emotions, decision-making, and memory processing. It's activated in that fight or flight response. Another structure, the fusiform gyrus, plays a role in facial recognition and the recognition of colors and words, and it can influence the amygdala's response. More importantly, our cultures, communities, environments, and all the other input, our brain filters and logs in the day, help shape the internal wiring within our System 1 brain. Some of this wiring runs through the aforementioned anatomic structures. Maybe, in the past, it helped us. The ability to quickly recognize a lion let us run away to safety. However, nowadays, it may not always be a positive influence, like you can imagine. As we've evolved, we've also increased our understanding of the interworkings in our brains and can study our thoughts and the processes behind decision making. Through this type of research, we have been able to increase our understanding of implicit bias with an exponential growth of studies in the past 2 decades, spanning many fields, from policing to education, business to healthcare. Now, I would like to move towards what I hope will be an illustrative exercise for y'all. There's a green sheet on your tables that kind of provides some instructions as to how to participate in this exercise. It's called the Implicit Association Test. It was produced by Harvard, and it is designed to show, for those who are willing to know, what may be on their mind without them being conscious of it. It measures attitudes and beliefs that people may be unwilling or unable to report, and may be especially interesting if it shows that you have an implicit attitude that you did not know about previously. There's a disclaimer on the initial screen that warns if you are unprepared to encounter interpretations that you may find objectionable, or maybe it arouses some of that cognitive dissonance, you may not want to participate, so proceed with caution. So now if we could all take 5 to 10 minutes to complete one of these tests. It doesn't matter which one you take, whichever appeals to your interest, and then we'll kind of regroup in a few minutes.